I am Dr. Laura Young. I'm a board-certified, fellowship-trained, minimally invasive GYN surgeon at Northwest Women's Care. I went to medical school at Penn State in Pennsylvania and then completed my OBGYN residency at the University of Maryland in Baltimore. And after 4 years there, I went to Indianapolis to do a fellowship in minimally invasive GYN surgery at Indiana University. So today I'm going to talk to you about endometriosis, which is a disorder that affects many young women. I'd like to talk about how the disease presents, patient symptoms, and how I diagnose it. Endometriosis is a common disorder in women whereby they have lesions in their abdomen or pelvis that are similar to those cells that line the uterus, but not quite. They often produce their own hormones and so are not necessarily dependent on a woman's cycle to have symptoms. The lesions typically cause inflammation in the pelvis and can affect any organ there, whether it be the uterus, the fallopian tubes, ovaries, bladder, bowel. Oftentimes the ureter is affected as well. And I've even seen patients with disease in their upper abdomen. Patients who have endometriosis may present with chronic pain. This typically starts as dysmenorrhea, but over time may progress and affect patients other days of the month as well. They can have pain with urination, with bowel movements, pain with intercourse, or just inability to go to work. So oftentimes ladies are taking time out from work or school, and over the course of many years it adds up and it affects their daily life. Statistically, we do know that about 1 in 10 or 10% of women in the United States are affected by endometriosis, so it's much more common than a lot of providers are aware of. So if women go untreated or are undiagnosed with endometriosis, as often is the case, over years this can lead to reduced fertility, whether that's by scar tissue, inflammation in the pelvis, or poorly functioning ovaries, and so ovulation can be an issue as well. Here at Northwest Women's Care, anytime we have a patient in whom we consider endometriosis, we talk about surgery pretty early on. First, because surgery is the only means of definitively diagnosing endometriosis. The benefit to that, however, is also how we treat the disease by excising or removing it. A lot of patients that we see have been put on hormonal treatment or placed into a temporary menopause to try to treat endometriosis, but that really does not halt or prevent the progression of disease. Some ladies that we see have already undergone a hysterectomy or even had their ovaries removed, even at young ages in their 20s and 30s, which we know because we've seen patients after surgery still have endometriosis throughout their pelvis. It's not the standard of care for endometriosis. It doesn't remove lesions and doesn't prevent the progression as well. We diagnose endometriosis at the time of surgery, so we use laparoscopy to look for lesions in the abdomen or pelvis. Typically we start looking in the upper abdomen because endometriosis we know can affect the diaphragm as well as the abdominal sidewalls. The appendix needs to be investigated as well, and then looking in the pelvis at the lining of the bowel, the bladder, and all of the pelvic organs. Fellowship in minimally invasive gynecologic surgery is an additional 2 years on top of the 4-year residency that I did to become an OBGYN. And during those 2 years, I was in the operating room every day of the week. I performed hundreds of surgeries on complex patients, on patients who have had multiple surgeries in the past, who had complex disease such as endometriosis. And they've done studies and shown that this level of training offers me the equivalent of 20 years of clinical experience. And so even though I'm very early on in my career, I have seen complex surgeries, I've performed complex surgeries, and I feel comfortable approaching patients with endometriosis. Patients who have any level of chronic pelvic pain or in whom you're worried about who might have endometriosis do warrant a consultation with a specialist. I'm able to talk with patients for an extended period of time and dive into the details of their pain. It's often multifactorial, and patients just feel comfortable talking to a specialist about that sort of issue. So if you have any patients in whom you're worried about, who you would like a consultation to talk about endometriosis with, then feel free to call our office at Northwest Women's Care.